am Dr. Kushagradhi Ghosh, Senior Consultant in Obstetrics and Gynaecology, Bhagirathi Neotia Women and Child Center. We are going to talk a little bit about recurrent miscarriages. Pregnancy is a very basic instinct. Everybody wants to become a mother. And when the patient becomes pregnant, it's always an enjoyable event. But sometimes, unfortunately, the pregnancy can miscarry, and it can occur to up to 15 to 20% of cases. Now, when miscarriage happens once, then sometimes it is possible to digest. But when it happens again, which can happen to up to 2% of cases, then we call it a recurrent miscarriage. And this is really disturbing both to the parents, prospective parents, the doctors, as well as the family. And there is always a cause of anxiety, frustration, and loss of faith in the medical community as well. What is important for us is to understand that in majority of cases, there is no definite cause, and fortunately, in majority of such cases, the mother becomes pregnant again and ultimately has a healthy life. This happens in around 80% of cases. But in having said that, when a woman does miscarry twice, it is important that she is investigated. One of the important causes for recurrent miscarriage is age of the mother, above 35 years, history of infertility. If she has been having difficulty in conceiving, there is a chance of miscarriage. There is a chance of increased miscarriage in patients who are diabetic, who are hypothyroid, are on thyroid medicines, who has high blood pressure, and sometimes in women who have polycystic ovarian disease. So what do we do in such cases? It is very important that these patients, this couple as such, because husband is also important in some cases, it is important to investigate them very well, and it is important to check their sugar, their thyroid, their pressure, their as a whole body continuity, and then we reassure them, do certain tests. One of the tests which is done is called karyotype, and karyotype is done for the mother and the father. There is another test which is called Aplas syndrome. We don't need to go into all those details, but it is important to understand there is a condition where we may have to use blood thinners to make the blood thin so that the oxygen and the nutrients go into the fetus. Sometimes what happens, miscarriages occur quite late, which is called second trimester miscarriage after 20 weeks or so. In those cases, one of the important condition is called loose cervix or cervical incompetence, and we can put a stitch around the cervix, and in those cases pregnancy can continue to about 80% of cases. So ladies and gentlemen, it is very important for us to understand that miscarriage is quite common. Recurrent miscarriage is not that common, but there are certain conditions which can cause recurrent miscarriage, and it is important for us to investigate before she embarks on the third pregnancy. And in majority of cases, with proper investigations and proper management, it is possible to have a very healthy child and bring a smile to the prospective parents. Please don't lose confidence. Please don't be frustrated. Go and ask for help. Don't hide your feelings under the carpet, because there is a lot of emotion involved as well. And after a multidisciplinary team with a proper care and support, there is light at the end of the tunnel. Thank you.